We're on the front lines of the coronavirus crisis in Texas and Florida, two states seeing surges in new cases, hospitals overwhelmed, running out of beds. In South Texas, along the border with Mexico, Hidalgo County has been especially hard hit. Since July 1st, COVID-related deaths are almost 6 times the rate of the state overall. The county health authority, Dr. Ayman Mohyeldin, tells the Wall Street Journal, quote, "The only way you get a bed in the unit is if somebody dies." I am now joined by Dr. Melendez. Also with me is Dr. Bernard Ashby, a South Florida cardiologist who's been treating COVID patients. Dr. Melendez, let me begin with you. You are also quoted as saying, "I cry every day." I want to talk to you a little bit about what you're seeing on the ground there in Hidalgo County.
Thank you for having me this morning and allowing us to voice what's going on in our community. We live in a community of 1.2 million people in an area that's approximately 35 miles long, and we are traditionally first and second in the country with per capita diabetes, as well as morbid obesity, and among some of the poorest areas in the country. So we have some significant challenges that other communities may not. Because of our proximity to the border, in fact, some of our communities are on the border, and it's not unusual to hear gunshots from the cartels intermittently. But also because of our regular state of health with such morbidity and diabetes, we have some special challenges. Currently, we're at a point where we're in a dire situation, have passed a safety point, to be quite honest with you. We went from approximately 8 to 10 patients in the hospital before we had an opening of the community to business. And now today we have 911. We went from 2 or 3 people on ventilators. Now we have 140 today. We have over 200 people in the ICU. And what the most interesting fact about us, I believe, is that it took us about 3 months to get to 12 people mortality. So out of 1.2 million people, 2 months to get to 12. Today, this morning, we're already at 22 people, and we're getting anywhere between 25 to 35 people dying every single day. Ambulance stretchers are being used to hold people. Sometimes people are being coded in the hallways. Our COVID units are full. We have a medical school. We have state-of-the-art hospitals. It's not because we don't have the technology. It's because we are just so overburdened with the volume of patients that we're seeing. So yes, Ayman, we're in a crisis situation here in the Hidalgo County of South Texas.
Dr. Melendez, do you have a understanding as to why perhaps we're seeing this surge now? Is there something that has happened in recent weeks, or is there a turning point in this when you look back over the past 4 months where perhaps you felt that maybe the situation was under control, certain things were in practice that were helping you curb that curve, but in reality now something has broken and now we're at this surge?
I think that's an excellent question, Ayman, and I think it illustrates something that's free of subjectivity. I think our situation is a very objective and very factual and science-based scenario. We had excellent results. As you know, traditionally, federal government delegates to state government, delegates to local county. And on May 1st, we had a change. On May 1st, we went from local flexibility and being nimble that was being managed by the county judge as well as our senator and our congressman. And on May 1st, our Governor Abbott, for whom I have the deepest respect for, but his policy was to do I guess a big plan, master plan fits all, where communities like Houston and Dallas versus where we're at, versus West Texas versus East Texas are completely different. Our governor has been outstanding in helping us get resources, but we have had 17 deaths per 100,000 people recently since July 1st. Houston has had 3 for every 100,000 people. The state has 2 for every 100,000 people. So our death rate is notably increased.
Right.
The question that we present is what has happened? And the only objective thing that we can see, how do you go from 13 people dying in 3 months to 22 in 1 morning? How do you go from 3 or 4 people, we're talking in 9 hospitals, 3 or 4 people on ventilators to approaching 150? And how do you go from 8 to 11 people in the ICU to approaching 250? How do you go from 12 people in the hospital to almost 1,000? There's only one thing that has changed, and that is social distancing. When we went back into opening up our community, which we, of course, desperately needed for financial impact and everything everyone knows, I think our community saw that as we were open, back to normal, and there was no longer a threat. We also have to take some local responsibility. It's not a politician's perspective. It's our responsibility as a community, and we've been very lax in staying at home. 4th of July, Memorial Weekend, we saw peaks. So succinctly, the answer to your question, the only thing that has changed is we went from tight social distancing and staying at home to where currently now that is not the issue. That is not the current situation.
Dr. Ashby, let me talk to you about what you're seeing on the ground there in South Florida, where emergency rooms are near or at capacity. Describe this scene for us that is playing out in your area.
So thanks for having me, Ayman. And Dr. Melendez, I feel you 100%, and I recognize a real one when I see it. And I can see the empathy that you have for your patients, and we're dealing with the same issues here. And so basically, Florida's a hot spot. It's hotter than July, and I'm not talking about the weather. And if you can look at the recent rates, yesterday we reached 156 deaths. That is triple what we were averaging 2 weeks ago. So what that means is that we're doing a poor job of controlling the outbreak of the virus, the spread of the virus, but we medical professionals are doing our job. There's only so much we can do because we only have so much capacity. And I would like to echo what Dr. Melendez said about capacity. We have actually done an excellent job of increasing our capacity, improving our ability to treat the virus. However, we can only do so much. If our leaders don't have our back, if they don't control the virus, we will get overwhelmed. We are getting overwhelmed. And I can attest to that because my own hospital, the ICU, is at capacity, and several hospitals around the state of Florida are at capacity. So this is an ongoing issue with no end in sight, and I am concerned. This needs to be a FEMA-level response that should be occurring right now, and that's not happening in the state of Florida. So we need to get on the ball, period.